Thank you, Mr Speaker. To ask the Secretary of State if he will make a statement on the government's preparations on industrial action.
Minister.
Well, thank you, Mr Speaker, and I'm grateful to the honourable member for his question, which I'm taking on behalf of the Department, as the Secretary of State is attending a COBRA meeting on contingency planning for industrial action in the NHS. And he also came before the House on this subject twice last week at departmental questions and then for the Opposition Day debate. Mr Speaker, we are all hugely grateful for the hard work and dedication of NHS staff, so we deeply regret that some union members have voted for industrial action. Our priority must be to keep patients safe. That begins with keeping the door open. The Secretary of State wrote to the RCN on Saturday asking for further discussions as a matter of urgency. At the same time, Mr Speaker, we're working with the NHS to minimise the disruption to patients if the strikes do go ahead. We're engaged with providers, professional bodies and trade unions to agree safe levels of cover should any action take place. In addition, this afternoon, ministers, including the Secretary of State, are attending a COBRA meeting which is focused on our contingency plans. Our plans draw on extra support from a range of places, including service personnel and the private sector, while we aim to minimise disruption, with the NHS already under significant pressure from the COVID pandemic and winter pressures. We remain deeply concerned about the risk strikes pose to patients. But I want to be clear, Mr Speaker, even at this moment of uncertainty, people must keep coming forward to get the care that they need. People should continue to use NHS 111 if they need medical help and dial 999 in the event of an emergency. For more routine treatment, hospitals will do everything they can to make sure planned procedures go ahead. But it is inevitable that any strike would mean some patients will have their treatment delayed and people will be contacted if their appointment needs to be changed. But, Mr Speaker, it's our hope that patients can be spared from unnecessary and unjustified strikes. Industrial action is in no one's best interest, especially in this difficult winter. We've had constructive meetings with the leadership of several unions, including the RCN, Unison, Unite and the GMB, and we look forward to further discussions to find a way forward together that is in the best interests of the patients that we all serve.
Thank you, Mr Speaker, and I thank you for granting this urgent question. The power to stop these strikes lies squarely with the Government and the Secretary of State. The Royal College of Nursing and Unison have said they will call off strikes this week if they are willing to negotiate with them seriously on pay. This is a reasonable offer of compromise that is surely too good to refuse. So what on earth are they playing at? After 12 years of Conservative government, patients can no longer get seen on time, staff have been pushed to breaking point, and they can't even be bothered to try to negotiate to prevent strikes going ahead at the worst possible time for patients and the NHS. The government should ask themselves why nurses feel they have to take industrial action for the first time in more than 100 years under a Conservative government, and ambulance workers are set to follow them for the first time since 1989. It should be obvious by now what the Conservative agenda is. They know that patients are going to suffer this winter and they have no plan to fix the problems of their making. So instead of taking responsibility for their failure, they want to use nurses and paramedics as scapegoats to avoid the blame. It is a disgusting plan, it is a dangerous plan, and it is a plan that will not work, because the public know the power to stop these strikes is in their hands, and if they fail to act now, patients will never forgive them. How many operations have already been cancelled? How does the Minister expect those on the waiting list to feel if their operations are cancelled because of their gross negligence? Can he tell patients which services will be impacted if these strikes go ahead? And isn't the Secretary of State embarrassed at COBRA today, asking the army to come in to clean up their mess? Even at this last minute, Mr Speaker, it is not too late to prevent these strikes from going ahead. Perhaps the Minister can tell us whether the meeting with the RCN later today will involve discussions on pay, and if not, why not? Because that's all it takes. Just a few minutes or a few hours of talk can avoid strike action. Why won't they do it?
Well, Mr Speaker, the fact is that Labour is all over the place when it comes to strikes. They criticise ministers while admitting the union's pay demands are unaffordable. Now, the gentleman opposite and his party leader are too tied to their union paymasters to be on the side of patients. Now, He knows, Mr. Speaker, he knows that we have an independent pay review body, and it's important that both sides respect that independent body. An independent body, Mr. Speaker, whose recommendations we accepted this year's increase in full, meaning that over 1 million NHS staff have been given at least a £1,400 increase in their pay. And, Mr. Speaker, that is on top of a 3% pay rise last year at a time when the pay was frozen across the wider public sector. But, Mr. Speaker, the RCN, one of the unions taking action, is asking for an increase that is 5% above RPI. Now, based on the latest figures, that is an increase of 19.2%, or equivalent of 6.5% of the NHS budget. Now, to meet such demands, Mr. Speaker, we would have to take money away from clearing the elective backlog the honourable gentleman references, something that no responsible government would wish to do. Now, throughout this period, Mr. Speaker, we have always sought to have a balanced process. Now, those in the private sector will not be getting a 19% uplift, and there is a clear need to be fair to the wider economy. We've got to avoid inflationary pressures that would make us all poorer in the end. So, Mr. Speaker, we'll continue to listen to colleagues' concerns, not just about pay, but about many other issues affecting the working lives of those in the NHS. We'll work with them to make those improvements in a range of areas, from working conditions to patient safety. Because we believe, Mr. Speaker, there is so much that we can agree on. Strike action is in no one's best interest, and we'll keep working so the NHS continues to be there for those who need it most.